Welcome, everyone, to this short podcast talk on the role and benefits of an enterprise browser within health and care settings. I'm Mark Blanchard. I'm the Public Sector Director from GovNews, and I'm delighted to be joined by three expert guests today. Joining me from Ireland, the global leading developer of a workplace defining enterprise browser, we have one of their founding members and the company's Chief Strategy Officer, Brian Kenyon. Hi, Brian.
Hello. Thanks for having me.
Great to be talking to you today. Prior to his innovative work for Ireland, Brian was the CSO at Symantec and Bluecoat, and the Chief Technology Strategist and CTO of McAfee, and Chief Architect at Foundstone. Brian is also the author of several leading cyber guides and publications, and is a frequent speaker at cybersecurity events worldwide. So great to have you with us. Pleasure to be talking to you. And moving on to our second guest panelist today, we have Robert Knott. Robert is the head of healthcare for Bytes Software Services. Having joined Bytes 6 years ago as part of the public sector team, Robert is now in charge of the Bytes Healthcare division and go-to-market strategy. He's responsible for building on Bytes' heritage and reputation within the NHS for Microsoft by actually bringing new and exciting technology to Bytes healthcare customers. So great to have you with us, Rob.
Thanks, Mark. And after Brian's introduction, maybe I need to add and needs to do better. But do have my 50-meter swimming badge, so hopefully that'll stand us in good stead here. But thanks for having me, Mark.
Good to have you. And our third and final guest of mine today is one of Rob's colleague, Jake Ross. Jake is the network security lead at Bytes and has been with the organization for the past 9 years and possesses a profound understanding of the evolving threat landscape, demonstrating unparalleled skills in fortifying networks against vulnerabilities and breaches. And being able to leverage a blend of technical acumen, strategic vendor engagement, and understanding customer needs is consistently engineering innovative solutions that are able to safeguard Bytes customers from the most sophisticated of cyber threats. So, Jake, lovely to have you with us and looking forward to talking to you.
Cool. Really pleased to be here. Thanks for having us. Don't even have a 50-meter swimming badge. Rob, you've got one up on me there. So yeah, well done.
Excellent. So that's our three panelists. Let's get started. Brian, I'm going to come straight to you. Would you please tell us about the role of an enterprise browser and perhaps a brief description of what Island do?
Yeah, no, I thank you for the opportunity. So, listen, Island's a unique company, not just because of the technology that we've built that's remarkably disruptive, but who we are as people as well. Many of us have worked together now for going on 2 decades. And one of the things that we were always very passionate about was we wanted to fix core problems and not just address symptoms. And I think a lot of times in cybersecurity, we address a lot of symptoms. And one of the areas that we've truly addressed symptomatically is around the browser itself. And the reason being is the browser is really came into our environments decades ago as part of the OS. And we used it to browse the web and shop and look things up and do research. And then slowly over the last decade or two, it became a very prominent part of our work on a daily basis. And yet the browser hasn't changed in its design and its functionality and its requirements. It's still unapologetically consumer. And so, as an organization that has to protect what happens in the browsers, we've done it by addressing symptoms, by addressing it with technology on the network, by addressing it with technology in the cloud, by addressing it with technology outside of the core browser. And so what Island, dared to do was take a revolutionary approach and say, what if we took a browser based on the common and modern browser feel today, which is Chromium, the basis of Chrome and Edge and Brave. What if we took that and purpose built a browser
Mm,
for enterprise organizations? What could it do if it was a more cooperative part of the enterprise IT stack? And what we found is that the possibilities and the challenges we can solve are almost limitless.
okay. So, Jake, I'm going to come to you. Byte Software Services boasts over 40 years of expertise in software and services and renowned for its work on managing licensing and technology agreements across a plethora of software vendors to its NHS customer base. How is this enterprise browser approach different from those more familiar cybersecurity practices in the NHS, like desktop virtualization or
Mm.
secure web gateways?
Yeah, it's a really good question, and it's a conversation I quite enjoy having, because for me it's fundamentally different, and I think where I tend to start the conversation is around the customer challenge. So whilst this approach is new or different or potentially not seen before, um, the customer challenges have kind of always been the same. So I've got third parties. How do I give them access to do their job in a secure manner without opening me up to a load of risks? Or my users potentially might want to go on the internet. How do I secure what they're looking at? How do I make sure that they're not clicking on terrible things that's going to ruin my organization, its reputation, and potentially put me out of a job? Or I've got a user that wants to bring their own device. I think we sometimes see execs say, I don't want to use your corporate device. I've got my own machine here. Or maybe it's a third party or a contract saying, I want to use their own device there. These aren't new challenges. They've been around for a very long time. And I think traditionally we've kind of taken that challenge and gone, right, what can we squeeze around to make this work? So if let's say we're using the browser, which Brian's just kind of alluded to, is basically was kind of a commercial platform, but it's now all part of our day-to-day life. How do we secure that? So we look at a web filtering vendor from vendor A, B, or C. We potentially then might look at a data security vendor from vendor A, B, or C, and kind of the list goes on. And as an IT team, we end up with, I would hate to put a number on how many different kind of management solutions or security tools we're wrapping on top just to kind of keep this kind of tool that we need to use in our day secure. Where Ireland for me kind of fundamentally changes that is it is a browser. And that's kind of the bit I enjoy talking to clients about is they say, hey, I've got a challenge around data, so I need to buy a data loss prevention tool. We can talk about a whole list of different data loss prevention tools, and that's fantastic. But when we start talking about Ireland, they kind of go, what is it? And I go, well, it's not really a data loss prevention tool. It's a browser. So instead of Chrome or whatever else that you're using, you're just getting a different browser. But fundamentally, I guess kind of security is baked in. So old customer challenges, a new way of potentially looking at it, but not looking at a platform and chucking a load of security on top. It's fundamentally built in. So.
Brian, I could see you nodding there. Is there anything you want to add?
No, I think, listen, I think that's a wonderful foundation of what the customers are feeling. From our perspective, the challenge and why you hear folks say, I have a data challenge, is because a lot of times, you think about it just architecturally, we've implemented controls for the browser on the network and in the cloud, not at the actual endpoint or the browser itself. So as you're browsing the internet, as the bits pass by those network controls, and those network controls and tools say it's okay for this data to be displayed to this user, well, then the unfortunate part of that is, as practitioners, we have to look at this and say, as soon as that data renders to the browser screen, I have to assume that data in use becomes data in motion. Meaning, just because it presented it to the user, that user can copy and paste it, they can print it, they can save it. And so I have a data challenge. And so what do we see? We see organizations try to protect this with expensive solutions like virtual desktops and desktops as a service, because it's truly the last mile where they can implement their control. And so what Island's doing is we're shifting that last mile from those virtual environments, from those expensive controls, and moving it directly to the browser. Contextually, from a security perspective, you have far more fidelity. And from a user experience, it's far more beneficial because it's natively happening right where they're doing the work.
Yeah. Well, I'll stay with you, if I may, actually, on that point, because as we've reviewed within the last white paper, whereby we've been exploring the NHS's Data Saves Lives strategy, the cyber resiliency plans, personal health data is essential for delivering care, yet it must be protected from inappropriate disclosure or malicious hackers. How are you feeling, and how can an enterprise browser, and indeed the Island solution, address this concern surrounding highly sensitive data?
Yeah, there's three kind of key areas I look at when we talk about this. The first is around the browser itself. And so one of the unique things that Island does is we wouldn't be a very good cybersecurity or even a very good enterprise application if the user could just circumvent and go to another browser like Chrome or Edge or Brave or Safari, where the controls and the processes and the workflow isn't embedded, right?
Mm.
And so one of the things we do is we enforce the usage of Island to connect to these critical applications. So, for one of our salespeople at Island or for a doctor, when they connect to an EHR for Salesforce for a salesperson, if they try to hit it with another browser, they say, hey, listen, you have to come from an Island browser that's tied to the organization's tenant. And so one of the areas we help is we add the browser as another factor of security. So even if you have a user's creds, you got to be coming from the right browser with the right authentication. The second way we help with this is, when you think about an application, one of the areas where a lot of healthcare organizations find themselves in trouble is there's sensitive data built into the EHR or the EMR, but not every single person that accessed that data record may need to see that patient's information. So again, by controlling the browser, we can control what data is displayed. So if you're not a practitioner, you're an administrator, and you go into a patient's record, maybe you don't see their vitals, maybe you don't see what prescriptions they're on, maybe you just see their payer, their insurance information, or whatever they need to process that transaction. So having control at the browser level allows you to customize what the application displays and how it works without ever touching the back end code.
Okay.
And the third area and the final area I would kind of touch upon is as users are working with data inside those healthcare applications. One of the things Island can do is protect and make sure that one, malware doesn't try to, infiltrate into the browser or try to steal that data in an active session. We've built protection around that. But two, that user can't copy data, they can't screenshot data, they can't take the data that you are concerned about and save it locally where the organization might lose control of it and it might be lost to the web or to harmful or people who are looking for to do bad purposes.
Mm. Asking the NHS users to switch to a completely new browser sounds a bit daunting. It sounds like a big change. Is it? Rob, what are your thoughts?
Do you know, I don't think it is. And I don't think it is because at one point we were all tied to Nokias and we were really happy with the 3310 and we loved playing Snake. And there was no browser. And then we moved on to an iPhone and then we realized an iPhone is really expensive and that's got its browser on it. And then we moved to Android or Samsung or another. And I think because the browser is used day in, day out by the consumer anyway, those same consumers are doctors, nurses, physios. They're the people that are interacting with that browser. So I think, probably 20, 30 years ago, yes, it would be because it'd be another tool to learn. But actually, the browser is a tool we're all really used to. We engage with it every single day, and it doesn't almost matter the flavor of it. So Island being based on that Chrome kind of technology, just it will feel and look the same, but
Right.
it's got that added security around it that everybody at the IT departments and the security departments at hospitals they want behind it.
Mm. Brian, do you feel it's a big change, or what sort of training is required to get staff familiar with a new enterprise browser?
Yeah, I'll give you a couple of thoughts here. I will tell you, when we started this organization, we thought about building this browser. We were very, very careful and very purposeful in the design to ensure that the user didn't feel any change from anything they've done in their career or in their personal lives. So the experience feels exactly like Chrome, it feels exactly like Edge or any other Chromium based experience. But as we've evolved, we've kind of changed that mindset. And we see an opportunity to not only provide that same level of quality of service and performance and stability, but we see an opportunity to improve that user experience. So we're all about making Island a better place to work for the enterprise user and the healthcare worker, rather than just being the same as Chrome or some of the others. On top of it, one of the things Island's done that's been hugely helpful for our organizations and customers that have deployed us is we've built the enterprise browser to be your enterprise's browser. So the look, the feel, the branding, the customization, the logo that gets pushed to the desktop, that's meant to look like your organization. So to your end users, this becomes the NHS browser or the specific hospital's browser built on
Mm.
top of Chrome. And the last thing I'd say is, what about end user training? And this is a true story with one of our first deployed medical systems. They tried to do end user training, and we actually made it to about 20 minutes of the first end user training session when one of the employees asked, "Why are you training us on how to use a browser?" And it was pretty much put to an end right there. So, from an end user experience, I think they'll figure it out.
Yeah, great question. Okay, so Rob, as demonstrated under this landmark collaboration agreement with Bytes, NHS England, and Microsoft, the NHS continues to benefit from the Microsoft Productivity Suite and is ongoing significant digital transformation to shift more applications from desktop to SaaS. How can the enterprise or how can Ireland interoperate and work in conjunction with Microsoft products to support this kind of deployment?
It's a great question, and to be honest, it's probably where this whole journey with Ireland started. Right, the NHS in England have put together a landmark agreement with Microsoft that is giving access to the Microsoft platform to every single trust and health entity in England. And while that's great, if you go down one route of one size fits all, you can end up with a costly bill. And as we're all probably all of us on this side of the pond at least, are UK taxpayers, we need an efficient use of the funds that the NHS available. Part of that agreement, every trust signed up and said, you know what, we will work towards using less on-prem software. That's fine, but of course that then pushes you towards the browser. And if you're starting to put all of your software you're using through a browser and you're using more and more SaaS, at that point your risk in terms of security and bad actors and all that kind of stuff is really increased.
Mm.
So having a tool that can protect the browser, but then on the other side, the finance side of hospitals, reduce your actual spend on key technologies, whether that be Microsoft or another SaaS platform. I think that's going to really benefit us across the whole. If you look bigger picture as well, I think if we really think about the browser that Ireland provides, the VDI platform as well, that's a really interesting take. We try not to talk about 2019 and 2020, but when we had to send everybody home and there wasn't staff working at home, everybody suddenly went, "Oh, I've got an old laptop I can use. I can carry on working at home." But they weren't great quality, right? They were laptops we'd all brought to do emails and web browsing. But actually, if you can then spin up a browser like Ireland that everybody can work through and it's secure, all of a sudden your teams are mobilized and you haven't had to make expensive hardware purchases. So there's a few different angles to come at here that actually it's not just all about the security side of things.
So, conscious of time, Brian, I'm going to come to you with this final point, if I may, finish off this talk today. For those listening in NHS organisations who are perhaps on the cusp of exploring the journey to enterprise browser adoption, can you tell us a little bit more about other health and care organisations that Ireland are working with right now, and perhaps any advice that you'd like to offer our listeners?
Yeah, thank you for the opportunity to address this specifically. We always knew, when building this company, that this would speak and resonate very acutely with the healthcare practitioners, and for a lot of reasons, but probably most prominently the fact that a lot of the practitioners, physios, doctors, nurses, they don't necessarily work for the organization. They're contractors, they're folks that move from hospital system to hospital system, working across patients in different systems. And so the ability to have an agile, very flexible, very lightweight way to do that, but not diminish the end user's experience, not diminish the overall security, was paramount. So as we've started working with healthcare, we've as we expected, we've been very successful with pharma companies, hospital systems, insurance side of the business, as a predominant amount of the applications they interact with are on the web, and they're looking for a light way to do it. And I'll tell you, as a true experience, one of the first hospital systems we signed up with, and this is a great example of the consumerization of the browser. For Chrome and Microsoft and Google and these browser makers, they want to stay with the latest and greatest and best parts of the internet, but that's not how organizations work. So this hospital system had an application that frankly only rendered an Internet Explorer. And so the way to make this work was they had to set up VDI for every single person so they could open VDI to open Internet Explorer to go to this system. And so by leveraging a browser like Island, they could just get to that system directly because we supported that because enterprise organizations need the support for it. So I bring this up because what started as a simple let us help with this one application quickly became wow, the performance, the experience, the security is really better than we ever imagined. Let's get everybody on this. And so what started as a deployment for 10,000 users quickly turned into 250,000 across the entire hospital. So a lot of success in this vertical for us, and we continue to learn from our customers and folks we talk to get better.
Interesting. Brian Kenyon, Robert Knott, Jake Ross, thank you very much for joining me today. I've enjoyed talking to you about Enterprise Browser. I'm sure our listeners have found the information you've shared very insightful. I'm Mark Blanchard of GovNews. Thanks for listening today to this podcast talk on the role and benefits of an enterprise browser within health and care settings, and goodbye for now.